A 40-year-old man is brought to the emergency department after being found intoxicated in a park. The patient reports a 10-day history of fevers, night sweats, weight loss, and productive cough with foul smelling sputum. He has a history of alcohol use disorder. Temperature is 102 degrees Fahrenheit. Lung auscultation reveals coarse crackles over the right lower lobe. Lab results show an elevated leukocyte count. Chest X-ray reveals a cavitary lesion with an air fluid level in the superior segment of the right lower lobe of the lung. Which of the following is the most likely cause of this patient's lung findings? Now, this patient is presenting with symptoms of a lung abscess. The definition of a lung abscess is liquefactive necrosis of the lung tissue due to a microbial infection, and this is going to cause pus formation within the lung as a result. Now, some typical symptoms of a lung abscess is going to include fevers, night sweats, weight loss, as well as productive cough with foul smelling sputum. And we're going to have this foul smelling sputum because of the liquefactive necrosis of the lung tissue. Now, the most common cause of a formation of a lung abscess is going to be due to aspiration. So, anytime we have a disorder that might result in periods of unconsciousness, it can lead to aspiration, which can cause lung abscess. So, this patient has alcohol use disorder. So, this can lead to a period of unconsciousness that can result in aspiration that can cause a lung abscess. Now, a typical chest x ray finding of a lung abscess is going to be a cavitary lesion with an air fluid level that we're going to see most commonly in the right lobe of the lung. Now, let's discuss what this means. Here is a chest x ray, and on the right lobe, we see this lung abscess. The top is going to be the wall of the abscess, this white area, and this dark circular area is going to be the cavity of the abscess. And below, we have this white dense area, and this is going to be the air fluid level, which basically indicates fluid within the lung cavity. Now, the reason why lung abscesses most commonly occur in the right lobe is due to anatomy. So here we see a picture of the primary bronchi. As you can see, the right primary bronchus is going to be more straight than the left primary bronchus. So if we were to aspirate something, so let's say that we aspirated a food here in the trachea, it will most likely go to the right lobe because it is more downward. So gravity is going to pull it to the right lobe. Now, the position in which the person was at during aspiration matters because that is going to change the location of the aspirated material within the lung. So if we are in a upright position, the aspirated material is most likely going to be found in the right lower lobe. So here, as you can see, the gravity is going to pull that aspirated material into the right lower lobe because this is going to be the lowest point of the lung. Now, when we are in a supine position, when we are laying down, the lowest point of the lung is going to be the posterior segment of the upper lobe and the superior segment of the lower lobe. So gravity is going to pull that material into this region, as you can see. So this is going to be the region where we will most likely see the aspirated material if the person was in a supine position. Now, lung abscesses usually form due to aspiration of oropharyngeal bacteria. So the answer to the question is going to be answer choice B, which is aspiration of oropharyngeal bacteria. And remember that risk is greatest in patients with one or more of the following. So periods of altered consciousness. So the patient that we had the alcohol use disorder. Also look out for patients having seizures and dementia. Periodontal disease, particular gingivitis, is going to be a risk factor as well as impaired swallowing. Now, a mnemonic that I like to use to quickly remember this is PPI. So if a attending asks me during rounds or something, I'm immediately going to remember the mnemonic PPI to kind of tell them all this. So this is a quick trick to kind of remember all the things that can cause lung abscesses. Now, the most incorrect pick answer choices was answer choice A, which is aspiration of gastric acid, as well as answer choice D. So it's not going to be due to aspiration of gastric acid because if we have aspiration of gastric acid, remember that it's going to damage the alveoli. So what we would see is hypoxia in the patient. And because of that hypoxia, patients will present with shortness of breath. And because there is inflammation throughout the lung, we will see fluid within the lung that is more spread out. Answer choice D is primary bacterial infection. This refers to tuberculosis. Remember, with primary tuberculosis, we're going to see enlargement of the hilar lymph nodes, as you can see here, and we will also see some ossification in the middle and lower lobes. This is known as Gone focus, and together, along with the findings of enlarged hilar lymph nodes, this is going to be referred to as a Gone complex. Now, reactivation TB is going to present with a cavitary lesion in the apex of the lung. So we won't see a cavitary lesion in the lower lobe of the lung. As a result, that answer choice is also going to be incorrect.